Welcome to Dateline Health. This is Fred Lippman coming to you from the Alan B. Levan Innovation Center, which is a combined effort between Nova Southeastern University and Broward County in the library building. I want to bring to you something which has, as we know, over these last 22, 23 years, we bring programming to you because of the questions that come to us by our viewers. And there's been an awful lot of conversation relative to brain injury, and not to take it beyond what I hear it from, but you know, a lot of people are beginning to see things on television like football injury and things like that. In my time, in my youth, it used to be boxing. So we have a certified expert in this arena, and the topic is recovery from brain injury. And we have Dr. Ariel Inocentes, who is board certified in physical medicine and rehabilitation. Welcome, doctor.
Good morning, and thank you for having me.
You're quite welcome. I know that it's located in the Broward Health Rehabilitation Institute at Broward North, and it's also it's one of my. I know the issue on the Joint Commission on Stroke Rehab. I know it very well, and I want to say that designated rehab center is an absolute gift to the human species. So welcome aboard, and tell us now, in your mind, what occurs at this Health Rehabilitation Institute.
Well, we have this rehab institute for the last 30 years now. So we actually have a lot of cases, all myriad of physical medicine rehabilitation, including brain injury, both traumatic and non-traumatic, spinal cord injuries, burn patients. Occasionally, we get some patients who have limb deficiencies, congenital, and as well as acquired amputations or limb deficiencies. Obviously, the bread and butter of the unit or of the rehabilitation unit is neurological. We see a lot of stroke, and when the population gets older, the higher incidence of stroke is we're seeing a lot in our institution. We're also a trauma hospital, so we see a lot of traumatic brain injuries that come in from the emergency room. So we both take all these cases together, and here at the Broward Health Rehabilitation Institute, we have certified therapists in brain injury, stroke, and other neurological injuries.
You know, I just want to let our audience know, your designated Joint Commission Stroke Center is really one of the first in the state of Florida. It was brought about by a group of physicians that were affiliated at Broward North that spent a lot of time in the capital of the state of Florida for us to create a stroke, I could say, rehab center, or in essence, they really saved lives because, as you could explain to the viewers, that now with people might not remember that for many, many years we didn't have trained EMT paramedics in our system. It came just about the period of time when this center was created through legislation at the capital of Florida. So you know, as I know, there's this golden period of time that if someone is, in quotes, communicated by the EMT paramedic back to your center, that all of the elements of what is indicated as a stroke, the quicker they get them to you and your team, the quicker they can get involved with minimally invasive techniques today. It makes it a lot easier. So you want to talk about that?
Oh yes. Very important is the EMS are well trained. If they recognize stroke, well, the first thing they do is, of course, stabilize the patient in the area at home or on the streets or in the grocery store, whatever the stroke happened, and they alert the emergency room that the stroke alert is coming. So the ER is ready. There's a golden period between 3 to 4 hours that you need to be able to bring the patient to the hospital so they could give you those clot busting medications to if there's a clot, then they'll able to give that medication right away. So the residuals are the residuals of the stroke are very minimum. And a lot of patients get those medications now. They don't need rehab. They go to the hospital, they're paralyzed from one side of the body. They get the medication within 2 hours, and in 20, 30 minutes, even to an hour, the symptoms have subsided. So from the emergency room, a lot of times they just do the evaluation and see where the stroke is coming from. And in 1 to 2 days, they're able to go home. But in some cases, if it's a big clot in the brain, then and the patient was not in the area of the golden hour, they're not able to give the medication, so you have more residuals. So it's very important that the patients get into the hospital as soon as possible, and that's why there's an acronym called BFAST. BFAST starts for B for balance, E stands for I for vision, blurring of vision. F is for facial asymmetry. You have one side is lopsided. A is for arms, for weakness on one side of the arm. S is for slurred speech or dysarthria, we call it. And T, the most important thing, is time. So if you expect something, you see something wrong, call 911 again, or and bring the patient to the emergency room as soon as possible, because that golden hour that to get those clot busting drugs is very, very important. It's between life and death at times, and a lot of times between maximum recovery versus no recovery. So it's very important to educate the public on recognizing stroke early.
Oh, I certainly remember. I was actually present, and I'm not going to get into my future of my past, but I was present when the center opened in Broward North, and I remember the commentary that came from the physician staff, and particularly the leader there, talking about the golden hour, which is basically what you're talking about. It's the 90-minute period. Is that correct?
That's right.
And it is really a marvelous thing, because my hat and my heart are thankful for people like yourself, and the question, or really your center is, like I said, one of the first 5 centers in the state of Florida to be created, and then the national groups started to place their imprimatur of approval by accrediting them. So there's a long history, particularly at Broward Health North. Knowing that you were a physical therapist before you were a physician, it's a wonderful combination, because people do not understand I guess, and it's not anyone's fault, they do not understand the mechanisms of movement and the body, and the involvement of the spine and other things. So it must be really a great value to you to have been certified before becoming a physician to become a physical therapist. Am I correct?
Yeah, that's very true. It really helped me a lot. It helped me relate to the therapist as well, to see their concerns, why the patient's not getting better. So I'm able to address it because we practically speak the same language, and the communication is much better. The harmony in working in a team that talk to each other and understand each other makes it better for the team to work with the patient, and it actually benefits the patient in the long run. And that's why our outcomes are very, very good I think it speaks to the team that's involved at Broward Health Rehab Institute. They work like a family. If you see our reviews in Google, even the patients themselves see it now, and we're happy that this is the outcome we're getting.
I'm also aware of the fact you have a support system for the families or the loved ones of the patient that was cared for. Would you want to talk a bit about that?
Yeah, we have a lot of support program that we have here. We have, I think we are alluding to the ARC program that we have. It's called the Approved Rehab Caregiver Program. We started that about 5 years ago when because every time the patient gets discharged, we get a survey, and from the survey, we're getting a lot of them are saying we're not prepared to take the patient home after a stroke or after a spinal cord injury. So one of the things that we piloted is to start training the family members or the caregivers as early as they're available. So we started at day one actually. Family training started day one if they're available. So the transition from home, from the hospital to the home is easier, especially here in Broward Health North. We have a lot of international patients, and we have, of course, they come in. They come from, let's say, from a cruise ship or from a vacation in Jamaica that we have, and then they come here, and then they fly all over from the different parts of the country to be with their loved ones. And of course, part of it, if they're there participating everything every day, seeing how the patient is doing, is an easier transition to home. And what I meant by that is at the beginning of day one, they see how the patients are doing, including the ADLs, including dressing, toileting, showering. They get trained how to handle the patient. So then they see the progression requiring initially total assistance, and later on requiring just supervision level. And it's very easy for the family member to take care of the patients at home.
Uh, the the other thing is that I know that that particular unit. In fact, I think it's throughout your system. The the cooperative effort of the multi-licensed health professionals is very, very important. We can't leave out all the nurse professionals that are involved, and the various rehab people that are involved, whether they be what you first elementally brought you to rehabilitation. You got sport, but there's so many issues that have to be discussed with individuals on a one-on-one basis. We just can't hand out a piece of paper and say, this is what I want you to do. So I think that also, to me, is an image of the excellence of your designated or your rehab center. Do you agree?
Oh, yes, yes. So our program is individualized on the patient's needs, and it's comprehensive because the physical therapist has their own program in conjunction with the occupational therapist, the speech therapist, the rehab psychologist. Aside from that, we have a myriad of specialists to see the patient too. The cardiologist need to see the patient. The cardiologist follow the patient while in the rehabilitation unit to adjust their medication. Sometimes your heart rate goes up during exercises. We need to that blood pressure and heart rate controlled well once the patient is putting effort on trying to rehabilitate themselves. So all specialists that are needed are within the hospital system that assist the patient, and there's continuity of patient care too, since the physicians coming from the acute side, from the medical floor, the surgical floor, tends to follow them up in the rehabilitation unit. So we have everything here that needed for the patient, uh, pretty much to make them successful in their rehabilitation.
Let me ask you this question, doctor. Do you see many patients from sports injuries? I mean, everyone has seen on television and professional football, particularly, and also baseball, some very significant injuries. No one really talks much about it ex post facto of seeing it, but do we have that type of situation occurring that brings sports injury patients?
Yes, very much so. We see them a lot of times in the acute side. I mean, you can say in the medical side. Once they get better there, they go to the rehab unit if needed. A lot of times, the young kids, they get a little minor injury in the knee or have a fracture. We have one patient who had a fracture in the femur, and we had to do some rehab. Went to our rehab unit, but since they're young, the rehabilitation is faster, and as soon as they're done with their orthopedic issues, they go home and they get outpatient therapy. Aside from the inpatient rehab, our outpatient therapy is also very excellent. We have therapists who are certified as well in neurological cases, orthopedic cases. So it comes as part of their rehabilitation after being receiving rehabilitation in the hospital setting.
Do you is there are you aware of the fact that here at Nova Southeastern University we have a very formative sports medicine rehab clinic, which where the physicians and the physical therapists and occupational therapists work together as a team. If you haven't seen it, I welcome you to come and visit with us.
Yes, I'd like to do that in the future. We'll, we'll go ahead with it.
How long is the traditional rehab? I mean, I guess it relates to the type and style of harm. Is that true?
Well, it's true. It depends on the injury of the patient. If it's a stroke patient that's very dense paralysis, it takes up to about our length of stay is about 10 to 14 days in here in the rehabilitation, and sometimes 21 days. But rehabilitation doesn't stop in the hospital. Once they're able to get home, we start them with home therapy, and then from home therapy, after that, you go to outpatient therapy. And usually the recovery period is up to a year or two. They still have some improvement even after 2 years. So really, rehabilitation doesn't stop when you leave the hospital. It's just the just start of rehabilitation.
I would assume that they also have to communicate with not only the patient, but the physicians and the nurse professionals and others as to learning and fortifying their ability to speak, to walk, and to be independent again. Is that correct?
That's very true. In fact, the continuum of care starts from the medical floor, the orthopedic floor, to the rehab and to the home setting. In fact, the orthopedic surgeon in the orthopedic floor also follows the patient in the rehabilitation unit while they're having their rehab here. And everything is continuum as far as the hospital setting is concerned.
That's great. Really. Well, we're very proud of your center, and we're very proud of the fact that not only do you mitigate the problems that are inherent to stroke and, shall we say, devastating injury caused by car crashes, motorcycle crashes, airline things. I mean, you've dealt with them all. I mean, I know the center has, but it's really something that many of our viewers had asked questions about, and I'm just guessing in my mind that because there's been so much communication via the television viewing of the injuries that are occurring, and that the importance of your center and the other centers that are here in our region of South Florida is almost, shall I say, an unknown quantity of knowledge as to how valuable they are to us as human beings.
Yes. Aside from Broward Health Rehab, we collaborate with the other rehabilitation unit, including pediatrics rehab that we have here in Broward County. So the rehab community is very small. So almost everybody knows each other. So there's collaborative efforts, not only between the physician but also to the rehab centers that are part of Broward County.
Oh, absolutely, without any question. Well, we're down to near the end of this show, so I'm going to give you the opportunity to say whatever you want to say about what you do and how proud you are of what you do. So it's all yours.
First of all, I'd like to thank you for having us today. And for the viewers out there, my take home note is that recognize stroke early. If there's anything you have to take out, is to, if you suspect stroke on a family member, remember the acronym Be Fast. Make sure get them early in that golden hour or golden period to get them as early as possible. It's between life and death situation. The earlier you get them, the earlier they get treatment, the less the residuals from a stroke. That's pretty important that to take home. As we have discussed earlier, as well here in Broward Health Rehab Institute, we have a very robust program that we take care of a lot of patients, not only stroke, but also including patients who have been in the hospital for many days in the ICU. Like, for example, we have COVID patients in the past that have been intubated for 3 months, and we're able to bring them home to their loved ones after 1 month of therapy. It's amazing how these people recover. So rehabilitation is an integral part of the for getting better, for healing. And rehab doesn't stop in the hospital. It continues in the home setting, continues the outpatient setting. Like I mentioned earlier, stroke after 2 years could have some progress. So don't give up on your family members. Just make sure they get their rehabilitation as early as possible. Bring them to the hospital when you have suspecting a stroke.
Okay, well, Doctor, I didn't mean to step on your words, but we're down to the last 35 seconds of the show. So I want to say thank you to Dr. Ariel Inocentes. I really appreciate your hard work and your dedication. And like I said before, to me, it's a blessing. It's a blessing to have well-qualified individual and service entities to care for the people who are our viewers. So thank you once again for being here today. And folks, if you have any questions, there's an email address and a phone number right here. And remember, this show is your show. And as I always tell you, if something is amiss relative to, oh, somebody is tumbling or whatever, speak to your doctors. Don't hide these problems from your physicians. This show is called Dateline Health. My name is Fred Lippman. Until next time, see you.